this paper was a summary, kind of a guide for general neurologists to be able to parse out some of the nuances in patients that have cognitive impairment. It goes back to how kind of muddy the clinical picture can be when we're trying to understand what a patient might have. And even though the advancements in biomarkers are exciting, they're really only a fixture right now in Alzheimer's disease. Previously you could only say someone had definitive Alzheimer's disease after they died, after we could do postmortem studies. But now with spinal fluid and PET imaging, we're able to diagnose Alzheimer's disease with greater confidence. That's the best we've got in neurodegenerative diseases right now. While the biomarker developments are exciting for other neurodegenerative diseases, they're not quite up to that level yet. And so there's still an incredibly high reliance on clinical skills, so being able to take a thorough history and pull out those salient points of someone's cognitive function to be able to understand what domains are actually affected, and then use that to guide your exam. So whether or not you're going to see elements of Parkinsonism, which might lead you towards, say, a disease like Parkinson's disease-related dementia or dementia with Lewy bodies, or even something else like multiple system atrophy, which can have some cognitive impairment with it as well. Other aspects of cognition that are important to delve into and may be difficult to elucidate in the context of a short appointment, but frontal lobe function can help a lot. So understanding, is someone craving sweets, or are they disinhibited, or are they becoming more introverted? A change in behavior can help steer you into some frontal lobe functions. Assessing language is incredibly important as well. And those are the kind of things that you really need to pull out with a careful and not too rushed history with your patients, and then have that guide the exam. After that, then you've got a lot more direction in how to use your biomarkers, which now we're harping on the importance of biomarkers, but other imaging modalities like MRIs, PET scans, and so we try to provide the readers with a nice kind of algorithm for if this, and this. It's not a cookbook recipe for diagnosing dementia per se, but it should guide people so that you don't find yourself in a corner and not knowing what to do.